Welcome to Your Family's Health. This is Dr. Jeanine Cook-Gerard, and I'm here with a nursing student, Shannon Scannapieco, from the Department of Nursing here at Nassau Community College. Your Family's Health is a program that focuses on healthcare issues and resources available here in Nassau County. On the show, we will be speaking to experts from around the country to keep you up to date on current healthcare issues and trends. Today, we will be speaking to Dr. Janet Farrell Leontiou about gaslighting in medicine. So if you want to know more about how to stay healthy in Nassau County, stay tuned for the next half hour to the Voice of Nassau Community College, 90.3 WHPC. Welcome to the show, Doctor.
Thank
Janet.
you. Thanks so much.
And we'll start by just telling us a little bit about the title of your book.
Mm-hmm. Well, the title is called Gaslighting Within Medicine, How Medical Culture Unintentionally Undermines the Patient. And there's a couple of words that are important in there. So if I could start by talking about the idea of gaslighting. The creation of the book happened when I was on sabbatical from Nassau Community College.
Oh, I should add that Dr. Janet is also an associate professor in communication here at Nassau Community College.
I am.
That's wonderful.
I am. And so I was on sabbatical from Nassau last semester, and my sabbatical leave started right in the same time as the inauguration of President Trump. And with Trump, there was a lot of talk about gaslighting and how people are gaslighted by not being told the truth, and it has different variations of meaning. And I started to think about how that actually is a word that fits my experience within medicine. And the word that I use in the title of the book is that it's unintentional. So the term gaslighting comes from a 1944 film.
Okay.
And it's where the husband is trying to convince the wife that she is going crazy. So he adjusts the gas lights, and then he denies that he's adjusted them when she calls that the light is changing in the room, and he denies it. So what I experience within a medical setting is that I frequently experience the feeling that it's a little bit, I used to describe it as crazy making. Things didn't make any sense to me within a medical setting. And that's why I used the terminology of gaslighting. And I say that the doctors are not intentionally doing it to me. It's part of the medical culture. And this is my second book on doctors. And my previous book was about medical culture and how I wrote about the culture of disconnection that gets established within the medical community. So this is a follow-up. And I also need to say that it's based upon my experience as the mother of a child with disability, navigating a healthcare system, and also as the professor of communication and really attending to the words.
So tell me your experience in the medical community, your experience in communicating with doctors, physicians. What happened? Well,
what happened depends upon what year you enter into, right? And I frequently talk about how my entree into the medical community started when I was trying to conceive, and I went through in vitro fertilization. And we consulted 4 physicians, and not a single doctor told us of the high rates of disability associated with multiple births. Everyone encouraged us to have multiples, and we did. And we have 2 boys who are almost 15, and one has multiple disabilities, and one child is typically developing. And so when I realized that, and then I looked it up after, because I didn't ask either at the time about that, because I wasn't online like I am now. I'd never asked about the rates of disability, and I was not told about the rates of disability, and we were encouraged to have multiples. And now I know withholding information is an example of gaslighting. So that and doctors have known about the rates of disabilities associated with multiples for quite some time. That information was held from us. So that was my entree into all of this, which is we were duped. And then it proceeded from there. And I wrote my first book when my son was 7, and then I wrote my second book when my son was 14. And I hope I'm not writing another book about doctors, because he had a medical crisis within the last couple of years that brought us back into a medical setting. And I didn't see change from the previous book. So I already wrote about a culture of disconnection. And then I just saw more of the same when we returned back.
I'm very, when I hear stories like this, and I'm always taken back, and I can say that I can empathize with you in this situation. But from, I am a nurse practitioner myself, was there any discussion with regard to a consent being signed before the procedures, in discussing some of the things that could happen as a result of your situation or your procedure that happened?
None.
No consent was signed.
None. And that's that in terms of, that's a legitimate question to ask, right? Of informed consent. There was no informed consent. We were not given the information, and I know that people can't wrap their heads around that, but that's what happened, is that there was no informed consent. And not only that we were really directed towards having multiples. So one doctor said, at least transfer 2 fertilized eggs, and hopefully you'll have a boy and a girl, instant family. And that was the language that was used. And I look back on that now, and I think I made the mistake of buying into that. That's not a way you create a family. That's the way you create instant soup. That's not a family. But at the time, I just went with it. And when my boys were conceived, we transferred 3 fertilized eggs. And thankfully, they didn't all implant. I would have had triplets. And I said 4 doctors. I had the procedure, the in vitro procedure, treated for a couple of times, and nobody mentioned anything. And the reason why I also speak about it is that I also know people who are going through the process now. And this is a really important point to make, is some of those people, they ask the doctor, what are the risks? And I know in one case in particular, the doctor said there are none. No risks. Everything has risks. I mean, how could something have no risks? But with regard to in vitro fertilization, particularly within that area of medicine, doctors do not have to comply with any disclosure towards the patient. So it's up to the individual doctor as to what he or she tells the patient. So I know my peers, for instance, who went through the procedure at the same time as me, received a very different story because the doctor chose to speak about the risks. And we happen to have doctors who didn't. And there is no requirement that they do. It's up to them.
I know that when we talked about informed consent, that patients do sign an informed consent before procedures, but you have here how doctors unintentionally undermine patients. Do you think that this was something that was an oversight, a lack of correct terminology or verbalization or communication that was used between you and the physician, or was this just something that was done because of the number of patients that they were treating? What do you think the factors played into this gaslighting, if you will?
Well, with regard to I have a different understanding of how certain communication and certain behaviors fall into the categorization of gaslighting now. and I could speak about that. But if I had to address how it played into the context of gaslighting then, when I was going through in vitro fertilization treatment, I would say, and I know a lot of people don't like this response, but I would say it's money. It's big money. And so that the more, and that's the focus of the doctor, the focus of the fertility clinic is that they want the greatest amount of achieved pregnancies and the greatest amount of live births. And after that, I don't think they even find out what was the result. I don't think any of those doctors know what happened in my particular case. They don't visit the NICU. There is no follow-up afterwards. So, and I don't think they want to know, quite frankly, because I think if you knew, you'd have to speak to that. So I think, I said money. So it's kind of driven towards, let's get the numbers, let's get the achieved pregnancies, let's get the live births, and then everything else is besides the point.
So with this, I hear a lot of things probably was left undone with regard to the safety, not just of your unborn child, but safety of you as you were going through a procedure. And there are a lot of things that are put in place now, like you say, like we talked about, informed consent and follow-up. So in your view, how can patients and healthcare professionals communicate more effectively so that this does not happen? What do you think? What do you think can bridge or bring together the healthcare providers with the patients in order for them to kind of improve the healthcare outcomes? Just not, I know of your situation, but of other people's. I know you wrote this book for not just, you're wanting to help people in the listening audience as well. Right.
Well, I'm particularly interested in parents who are raising children with disability. And there's, I think, a whole lot of things that need to be said with regard to that population and the whole issue of disability. But I think the Internet has made a tremendous improvement in healthcare because the thing is, you can find out anything you need to know in a very quick amount of time. Do your own research. And I talk with my students all the time about the importance of asking questions and that you don't learn unless you ask questions. But sometimes you have to have been educated enough to learn what questions there are to ask. Right?
Absolutely. So education is key.
So that if you do the research and then you can ask intelligent questions, you can't just say, well, what is that? You have to. I've spent a lot of time online and looking at a lot of things because my son has a diagnosis of cerebral palsy. And I don't think he has cerebral palsy, but I don't know what he does have. So I've spent a lot of time just trying to rule things out on my own and researching. And in terms of listeners, if you don't know already, but there's a site called PubMed, PubMed, and it has the publication of every article that is written by a physician in the world. So you put in a search word in that, and you're going to get a lot of hits. And you can start to go through and sort of fine-tune it and figure out for yourself. So,
and also a second opinion, I should say, that, when you go to a practitioner, that you're not getting the diagnosis or you're assessed by one practitioner, but that you're getting also the opinion of another practitioner, or maybe more than 1, 2, 3, or possibly 4, depending upon if there's any gray areas or if there's any question in your mind. This is always something that you can do.
And see, this is what you had asked me before, is what can patients do? And I think the whole movement now where you advocate for yourself or you advocate for your own child can only bring about good. It's very, very dangerous to turn your life over to another person without your knowledge and your involvement in that process. So that for me, in terms of, because of my experience with this original situation with the IVF, I don't do anything with regard to my